हम पढ़ेंगे फार्मास्यूटिक्स फर्स्ट से कुछ मल्टीपल टाइप्स क्वेश्चंस, यानी कि ऑब्जेक्टिव टाइप्स क्वेश्चंस क्या होते हैं, किस किस तरह के फार्मास्यूटिक्स फर्स्ट से ऑब्जेक्टिव टाइप्स क्वेश्चन पूछे जा सकते हैं। कोई भी कॉम्पिटिटिव एग्जाम्स हो, चाहे वो फार्मासिस्ट का एग्ज़ाम्स हो या फिर आजकल जो सेमेस्टर एग्ज़ाम्स वगैरह हो रहे हैं कोर्सेज के, वो भी ऑनलाइन मोड में कराए जा रहे हैं। उसमें भी मल्टीपल ऑब्जेक्टिव टाइप्स क्वेश्चन पूछे जा रहे हैं ड्यू टू कोरोना के जो गाइडलाइंस आए हैं कि कोई भी ऑनलाइन एग्ज़ाम नहीं कराए जाएंगे। तो चलिए पढ़ते हैं। क्वेश्चन नंबर 1, द स्मिता इंक्लूड्स रेफरेंस टू ड्रग ऑफ एनिमल्स, प्लांट्स एंड मिनरल्स origin which until the first country aid. Correct answer is Charka, who is the father of medicine. Hippocrates. Use of formulation made up of numerous plants referred as. Glanina. The first pharmacy shop was opened in Baghdad. The first edition of IP was published in 1955. The second edition of IP was published in 1966. The third edition of IP was published in 1985. Question number 8. The fourth edition of IP was published in 1966. The fifth edition of IP was published in 2007. The sixth edition of IP was published in 2010. The seventh edition of IP was published in 2014. The chairman of the first edition of IP was Dr. B.N. The Pharmacy Act came in force in 1948. Next question is, Pharmacy Council of India PCI was established in 1949. What is USP? Full form of USP, the United States Pharmacopoeia. The first US Pharmacopoeia was published in 1820. The first national formulary was published in 1988. The supplement to the first edition of IP was published in 1960. Supplement of the second edition was published in 1975. Drug converted to suitable forms are known as dosage forms. Full form of MDI, metered dose inhaler. Every dosage form is a combination of drug and different kind of non-drugs components called additives. Simple syrup is a saturated solution of sucrose. In purified water, the concentration of sugar according to IP is 66.7%. The separation process is well situated for mixing of the following powder. Ectotic. Next question is, which of the following is a ectotic substances? Methanol, thiamphol, camphor, ये सारे होंगे। उसके तक a convenient method of mixing redox substances, spatulation. Capsule in which powders are enclosed are made up of gelatin. Dutches are meant for application in vaginal activity. In female, the drug should be given very carefully in which stages? Menstruation, lactation, pregnancy. ये सारे ही correct answer है. Which two or more drugs are used in combination to increase the pharmacological actions? Phenomena is known as synergisms. When the action of the drug is opposed by the other drug, the phenomena is known as antagonism. Is the state of physiologic and physical drug dependence addiction accurate? Tolerance is also known as tachyphylaxis. A generally determined abnormal or unusual response to a drug is idiocracy. Powders used for external use are dusting powders. Bulk powder are non-potent. Insufflation are introduced into which of these body cavities? All of those. Powders are more suitable than syrup. A suitable is added to maintain the powders until the mass become coherent but not damp. Gelatining, which will include the bulk of product diluent. According to IP 2007, oral powders are finally divided. Which powder must be sterilized before their use? Surgical dusting powder. The monophasic liquid dosage form is a solution. True. The component present in solution in small quantity is known as solute. The component present in solution in large quantity is known as solvent. Solutions are dosage form. Monophasic. Throat paints are liquid preparation. Viscous. Nasal drops should have pH 5-6. Nasal drops are isotonic. Enemas are also called as Slatteric. The syrup is a nearly saturated solution of sucrose. The syrup is a nature of aqueous. Which of the following is not a monophasic liquid dosage form? Suspension. Elixirs are hydroalcoholic liquid. Is not a type of syrup. Mixed syrup. Liniments must not be applied on the skin. Broken. Enemies are administered rectally. In artificial syrup, which ingredients are used? Saccharine. Which of the following excipient act as preservative? Thymomersals.